Are town EMS providers paying too much back to the state in taxes? That's a question now in front of Vermont lawmakers. Channel 3's Cam Smith spoke with one provider who says that money could be spent elsewhere. What do you know?
Yeah, Darren, since 2018, EMS agencies have been required to pay what's called an ambulance agency assessment fee out of their annual revenue. Now, some departments like Shelburne want to see that tax repealed because they say the reimbursements they get are not quite offsetting the tax money they pay in. Shelburne EMS says annually they respond to more than 1,600 calls for service. On each one of those calls where a person is transported to the hospital, insurance companies reimburse the department for service, but a portion of that revenue is paid back to the state.
When we aggregate the figures, we're looking at over $100,000 in the last 6 years.
Right now, all ambulance services in the state are obligated to pay back 3.3% of their total revenue, which is then used by Vermont's legislature to lobby for a higher reimbursement from the feds through Medicare and Medicaid.
Medicare and Medicaid usually about 70% of your transports. So that's a very important part of your income, and we always ask the legislature if they could please try to somehow make sure we're at least getting some kind of parity on what we're being paid for those patients.
Last fiscal year, Shelburne Rescue paid more than $15,000 through the assessment fee. Chief Andrew Kale is now asking the legislature to repeal the fee. He says the money spent in taxes could be better used elsewhere for things like equipment and employee pay.
Right now, we are contending with the cost of inflation, and with that, not being able to use that $15,000 to help offset costs in other areas ultimately means that we need to ask for a larger budget from the town.
Members of Vermont's legislature say it's worth a conversation this session, but the issue is not a simple fix.
What everyone needs to understand is that the provider tax overall is paid by a number of providers across the state. And when we change one, then we have to look at all of them together.
Now, Senator Ginny Lyons says it's also important to look at what neighboring states are doing and then take that into consideration. She says after an in-depth look at the statewide EMS system last session, reports are expected back soon. Kat and Darren.